I wanted to give you an update on the fantastic response that we had to the COVID-19 Community Relief Fund. As you know, when the pandemic first started, we started a relief fund that we thought, when I first put the first goal out, it was $250,000. And within 2 days, I knew that I had to increase that to at least $1 million to handle the need that we were going to see in our community. And as you know, our population is about 367,000 people, and while the county is 70% white, what we saw during the pandemic and continue to see is that more than 48% of the cases were affecting people of color. So a large disproportionate amount of the cases were people that were living in poverty or living with extreme need. So what we needed to do when we set this up, the Community Relief Fund was specifically set up to help respond to the areas of highest need in our county. There's a county map with zip codes up there. We typically talk about the areas via zip codes, just for easily identifiable areas. And so 48197 and 48198 were high areas of need. I want to take just a moment to say thank you to the Tocqueville members on this call and to the entire group, because it was so just heartfelt and rewarding. Over 50% of our Tocqueville members gave to this fund, which helped us meet the $1 million goal so quickly. Another thing that we really wanted to be sure that we were doing was to make sure that we turned these funds around quickly. We knew how critical the need was in our community, and so our community impact staff worked diligently around the clock to make sure that the dollars, as soon as they were received, were being deployed back into the community. What's so great about that is that to date, we have funded over 55 programs, and by the time we collect the last pledge, we will have given to over 65 programs in our community. I would love for you to visit, and I'll include it in the chat box, the website, so that you can see every single program that we gave to. It was really quite amazing. While a large portion of the dollars went to 48197 and 98, we made sure to include the rural areas of our county. Some of you may know that Manchester is a small rural community on the west side of the county. Well, they recently lost their pharmacy. They don't have a grocery store, and so they are in kind of a desert almost of services. So we made sure that we were giving that area and that community as well the things that they needed to make sure that their residents were taken care of. We also wanted to just thank the people that served on the COVID Relief Community Advisory Committee, and they stepped up and helped us look at the grants. They helped us look at the awards as they went out. There is a new article in Concentrate. We also were included in a number of different MLive and radio shows, just to keep everything as transparent as possible. We wanted to make sure people knew we were collecting dollars, that we were distributing dollars in the most expedient manner possible, and with the broadest range and reach to cover our county. One of the things that we have seen is people increasingly need help with financial navigation services. And many of you know that we have a financial coaching system, but we're kind of shifting gears to meet the needs of community that simply have never been unemployed before. They don't know how to apply for unemployment. They have never needed a food bank before. Food Gatherers has reported a four-fold increase, with over 40% of that increase having never accessed a food security or a food bank before. So people need help with navigation services, and we're going to be here to make sure they know how to be connected. They know where to turn, and they know that the community cares about them and that we're here for them. Many of you know about 211. So our 211 call center is a 24/7, 365 service. We have seen, of course, a great increase in calls to that. The top 3 calls in our community are for food, housing, and health. No big surprise there, right? But with those calls are so many new users who just simply don't know how to navigate and get through and find the services. Because we fund the services, now we have to make the connection for people to make sure that they know where the local food bank is or how to access healthcare. Interestingly enough, some of the newest grants that we've given to like Packard Health and Corner Health has been for telehealth services. So more and more people are accessing healthcare through iPads, computers, telephones, because they can't be there face to face. And so some of the grants went to help our local nonprofits that provide healthcare services with those kinds of options to make sure that they're reaching all of the clients that they need.